What we want to share with you today is what we've been doing in the last 7 months. So we've only been in existence for 7 months as a collaborating state. And we really felt that we wanted to come up with a true mission and vision to determine what impact we could have in our state. So we want to reduce these disparities. And as you heard me say earlier, we have the highest rates by state in the whole nation. But they're even the highest rates, even worse, in eastern Kentucky and the Appalachian foothills. We are led by a group of researchers from the University of Kentucky, but we are very strong in our partnerships across the entire state. We have tried to meet and talk with and bring together every coalition in our state that is working on cervical cancer, because we see ourselves as conveners of all of those groups to try to be a mass group of individuals that can work on this issue. So our mission is to do just that. And through that coalition, we want to prevent the HPV infection. We want appropriate and timely screening and diagnosis. We want to assess the follow-up care and treatment, as well as change health policy in our state. So one of the ways we thought we would do this with our partners is give them the opportunity to look locally to see what issues they are facing. And to be able to do that, we decided to give many awards. And so last year, even though they only had 7 months to work on it, we thought they could do a lot if we could give them just a little bit of money. And to me, $20,000 is a little bit of money. But you'd be surprised what these 5 groups across our state was able to do with that little bit of money. And so we awarded 5 awards last year, but we had 20-some applications for 5 slots. And we were only going to give 4, and they were all so good we decided to give a 5th one. So I was very pleased and astounded at the interest. And we have had initial reports back, and in your packet you will see some of those initial reports. And I would refer you to our website as well. You can get a tremendous amount of information as to what's going on in our state from that website. We also distributed a lot of PSAs across our state, especially in January, to coincide with the Cervical Cancer Awareness Month. Those PSAs are also on our website as free downloads, so you're welcome to them. But we used real Kentuckians from our state and different regions to do these PSAs, because we wanted people, if they were from eastern Kentucky, to sound like me, you know. So they're saying, this is somebody that knows what I'm going through. And if they were from inner city Louisville, we wanted them to sound like somebody from Louisville. So we used local folks. We also worked to help bring together all those coalitions I mentioned, and I've listed a few of those here on the slide. This is what our website looks like, and you can see we've tried to come up with categories that we thought were very friendly to navigate, because we want people, no matter how comfortable they feel with websites, to be able to find what they need on our website. And I can tell you it's been very productive. We've had lots and lots of communication come in from this website. This is the locations of our many awards. As you can see from our state map here, the blue areas is where these individuals received $20,000 to do a 7-month project. And we didn't mean for it to be this well distributed, it just happened when we reviewed the applications. And you can see that 4 out of the 5 are actually our local health departments or regional health departments, and then 1 of them is actually in Louisville, in mostly the African American population, with Norton as a partner. Now, we see this as another way to develop those grassroots coalitions, to begin to help educate people in all the small locales. And, you know, a famous quote from Kentucky is, all politics is local. And if you want to get something done, you've got to start at the bottom. And I think that's been one of our problems, is we've always thought that we could go to Capitol Hill or we could go to Frankfurt and we could talk to a legislature and they'd understand what we're talking about. And they'd help us change things. But in my experience, I've found that if I go to the people and I say, we need your help, and here's the information you need, ask me any questions so we make sure we understand each other, and then let's go together and talk to our legislators. So that's what we hope to do. And you can see here that there was a different focus for each one of these mini awards, and they were able to develop their project when they sent the RFP in. And you can see just after 2 months what some of their outcomes are. Now, at the end of June, we will receive their final report, and we now are going to be able to offer more mini awards this coming year as our second year projects, and we're going to be able to share that news with all of our state this coming Tuesday, when we are going to have our first statewide spring conference in Lexington, Kentucky at the Embassy Suites. We were very fortunate in that we're going to have a speaker from CDC, Galen Cole, who is going to talk from the CDC's perspective what states ought to be doing. Then we're going to hear from one of our local family physicians from a physician's perspective as to what physicians or providers ought to be doing as in regards to cervical cancer. And then we're going to be able to announce the new series of awards that are coming up for the coming year. So for year 2 funding, what are our aspirations? What do we hope to accomplish? And we wanted to share some of those with you. We want to continue to build that statewide network of coalitions, but also that statewide network of grassroots people, moms, dads, local companies, the YMCAs, everywhere that we can think of to get people to get behind this movement so that when we get ready to start policy change and we go to Frankfurt, it won't just be a small group of people. It'll be a large coalition. And I've always had the people in Frankfurt say, you know those little pink slips on my desk? That's what we count. Every time somebody calls in, every time somebody sends an email, those are the things we count. So we want them to have so many of those on their desk when we tell them that HPV vaccination should be an opt-out mandatory vaccine for children ages 9 to 11. We want them to have so many pink slips they can't say no. We want to enhance our communication. We have developed a wonderful relationship with our communications department at UK. We have developed a video called 123 PAP, along with our coalition and partnership with the Rural Cancer Prevention Network, which Dr. Rick Crosby is a PI on from CDC. And we work very closely together as partners on those projects. We're creating culturally appropriate targeted messages for all across our state, depending on the group of people we're looking at. We want to focus on earned media as well as social media and enhance the statewide push for these policy changes. Also developing a database statewide as far as vaccination, screening, and treatment. We hope to look at the possibility of developing an application for vaccine mobile units using the iPhone, and we've heard that about media before, because we know that's how our youth connects with each other. I don't know what they're going to do if they ever have to talk to each other face-to-face again. We also want to award those second round of grants. Now, one of the other things I'd like to share with you is if you look at your 2-page report in your packet that we developed, on the back page you will see a billboard. We also worked with the RCPC in our state and developed 3 billboards, and those billboards are posted in those areas in eastern Kentucky where cervical cancer rates are the highest. That was our first big push, and we did that as a partner. And to me, that's the biggest message here today that I think I would share with you, is that you can't do it alone. You need to partner with everyone in your states that is working on this issue so that you're not at crosshairs with each other and you're all talking from the same sheet of music. And whatever you try to do, you've got a bigger coalition working behind you to get it done. Thank you.